see what's going on at Field Trip. I know you guys have been incredibly busy and just expanding at such an incredible rate.
Yep.
Would love to know kind of what's on the table right now. What are you currently working on?
Right now we're focused on continuing to execute our strategy, which is opening up new clinics. We have some exciting new developments that we'll be talking about soon, but still under the radar for right now in terms of expanded offerings, but focus on opening up the next few clinics. We're opening up in Miami, where we are right now. We've got Austin, Washington, D.C., San Diego, San Carlos, so still a lot of work to do. And then our drug development efforts are continuing in earnest. So we hope to be in phase 1 clinical trials for FT104 early next year, and we'll have some other announcements around that soon as well.
That's very exciting stuff.
Thank you.
Great. When was the last time that you got to enjoy a healing trip for yourself?
The last healing experience I had was a few weeks ago. I was down in Boston, and we worked with a couple of local guides who were quite exceptional. And then prior to that was actually at our Field Trip location in Santa Monica, where I was fortunate enough to have a ketamine-assisted therapy experience with Dr. Mike Dow, one of our therapists there, and Dr. Randy Sharlock, our medical director. So it was really nice.
That's awesome. Do you have a preference in terms of the medicine that you think is more effective for yourself?
I'm still learning. I'm still a bit of a newbie here, so no, I don't have any particular preferences. I've noticed distinct differences amongst them, but I'm going to reserve judgment on that for now.
That's exciting. And so I'd love to know, where do you think everything is going to be headed for Field Trip? What do you ultimately want to kind of achieve, with the company?
That's a big question.
It's a big question.
It's a big. I think the most important thing we can do is set the narrative, set the conversation around what's happening. Really normalize the conversation around psychedelics. Even people who are very open-minded about it are still resistant to psychedelic-assisted therapies because they'll look at their lives and they're like, my life is pretty good. Could be better, but I don't know if I want to take a chance with psychedelics, because that stigma that still exists from all the years of the war on drugs and the DARE program and all that kind of stuff, still in everyone's subconscious, even if consciously they're aware of how politicized that conversation was. So driving that narrative, really normalizing it, making it accessible to people, both in terms of conversation and culture, as well as finding ways to make the cost considerations more accessible. Those are, I think, the legacies that Field Trip can create, and that's what we're working on. So
that's great. You guys are doing excellent work, and just cannot wait to see how this continues for you.
Thank you. Appreciate that. Thank you for all your support along the way.